Good morning, good afternoon, good evening, wherever you are in this world, especially here in this room. I'm really pleased to had the call from Lucky actually about being here as a representative for, let's say, well, Google for developers, but also maybe as a representative of Mauritius as an island where I'm coming from, even though that I'm originally from Germany. Yeah, I hope that the title of today's talk about escaping death, I thought it is a good topic in regards to the Escape Conference, is actually not scaring you too much. And I'm giving you a little bit of a, yeah, let's say personal story about, dodging the Grim Reaper. Gave me a couple of ideas in regards to go forward about how to use AI for a little bit of a, coding experience. So I like to take you on this journey and see how you like it, and I hope to get some conversations afterwards then in the maintenance area as well. So yeah, a story. It started simple, it can happen to each and everyone. You feel a pain in your gum. It's weekend. Consultation is not really possible. And so you're bearing with the pain, at least on the Saturday, on the Sunday. However, on Monday morning, you try to get an emergency appointment with the dentist, so you get your consultation. I think it's a familiar situation for each and everyone here. And yeah, that's how it effectively started with this kind of simple scenario. Why is it a case of medication error? Well, the dentist actually gave me then a prescription, and I hope this is working, for an general antibiotic because it was an infection in the gums. And the product is called Amoxil 500. It's a standard amoxicillin, which is like a class of penicillin, taking care of infections, bacterial origins, and 500 milligram, everything is fine. Of course, like everybody else do it as well, you take your prescription in the morning hours, still swollen cheek, you go to the pharmacy and you hand over your prescription in order to get your medication in combination as well with some painkillers to, treat your actual problem. However, pharmacy is not equal to pharmacy. And it turns out that my clicker is having a hiccup. Let's see. Well, one back, one forward. Okay. At the pharmacy, I was handed over a product called Amaril M500. I mean, okay, sounds very similar, Amoxil, Amaril. However, one is for the treatment of infections. The other, unfortunately, is for treatment of high levels of sugars in case that you are diabetes type 2 patient. And as a non-diabetic, well, it's a little bit of, how would you say, wrong medication. And so, yeah, I just gave you the rundown. There are actually two ingredients where the name comes from. So there's the Amaril component, which is like influencing your pancreas to actually release more insulin, which is then lowering your blood sugar levels. And on the other side, this metformin, 500 gram, is also then has the purpose to take care of the reduced blood sugar that is then deposited in your liver to get rid of it. So everything normal mechanics for a diabetes person that has high blood sugar. So maybe, if possible here, with via hand signs, anybody, if it's not too personal, has medication in regards to diabetes. All right. So you have eventually good understanding what I'm talking about. Now imagine your medication. Thank you. Yes, exactly. So now imagine your medication gets into the hands of your loved ones, yeah, and is then used. That was not really a problem in the first place. The actual problem came that the prescription, let me just go back, the prescription from the doctor, from the dentist, actually stipulated one tablet 3 times a day for the next 4 days. Afterwards, I spoke with diabetic people that actually are aware of this medication, and they said, if they have a good day, they take half of a tablet once per day, and it is still too strong. So that they have, after an hour, they need to compensate the drop of blood sugar with a little bit of a, fizzy drink. And yeah, now imagine 3 tablets per day for the next 4 days. Well, I mean, I have to say, it worked. It worked magic. However, and even the infection in my gum, fantastic. After 2 days, it was gone. However, it went for the wrong reasons, because it was not the antibiotics that took care of the bacterial infection. It was actually the lack of sugar that was deprived from the bacteria and starved them to death. So, I mean, already with this kind of, situation that I was totally not aware, because I was like, hey, yeah, it's cool, it's working. The medication is fantastic. My infection is gone, my pain is gone. I was super happy about being pain-free so that I could concentrate on my work again. And that was like on the Wednesday, maybe let's say Thursday. All fine so far. However, as you might also see on the comic strip, my consumption of soda drinks, like, any brand, whether it's Coke or whether it's Pepsi or whatever, anything that, or even fruit juices, the consumption went extremely up. I had really like this craving for soda drinks, where I usually only have like water every day, still water, sparkling water. And so yeah, so having about 3 to 3.5 liter of Coke was not my usual consumption ratio. But okay, I thought maybe it is related to the medication, it can happen, or, anything else. But in the first place, it never came to my mind that, there's a problem with the actual medication. So meaning that the days were fine, I was pain-free, I could work, I could do, the regular things, bringing the kids to school, the wife was happy that I'm really in a better mood. However, the consumption of Coke and fizzy drinks, that was a little bit off. In comparison, the nights were quite tough, because for a person that is used to, put the head down on the pillow, be asleep, and about 6 hours, 6.5 hours later, be awake, it was tough, because I woke up, I don't know how many times, at least twice, in the middle of the night, and I'm talking really about the small hours, like 2, 3 o'clock in the morning, went straight down into the kitchen, took a half-liter bottle of soda drink in one go, gulped it down, didn't care at all, released a nice burp, not too loud, not to wake up anybody in the house, and I went back to sleep. Still, I mean, there was this signal in the bodies about, something is not right, but okay, maybe it's the medication, maybe not. It's just a normal procedure, because We all trust our doctors. We all trust our pharmacists, right? All right. Well, going on, we're talking about starting the treatment on the Wednesday or on the Monday, starting with the dentist. So we are like almost at the end. Let's say about after 3.5 days, my wife started to freak out because on the Saturday morning, like with, I think, 2 pills out of those 12 to spare, I woke up like not being present. You know, it's a scenario, a situation where it's like you're waking up with a film over the eyes, like still living the dream, but being alive. And so therefore, she was then contacting one of the assistants from a trusted doctor, independent from the dentist, and she directly got the advice, no matter what, ASAP into the car, rush to our ER department, and it was a drive of about 15 kilometers, which is normally not a problem, and bring me in. And I was still on, like, you know, my daughter is like, Dad, come on, get dressed up. Yeah, okay. This is really not fake. This was really like the situation, how I was in the morning compared to, you know, normal situation. I can only tell that I went into the car. This is something I remember. I remember that we were halfway to the hospital, and then it was night. Anyone experience this? That you have like really blackout? Yeah? So that you are actually appearing to other people like you are fully awake, you answer, you are interacting. However, you have absolutely no memory about what happened. So I have no idea that we parked in front of the hospital. I have no idea that my wife guided me on the hand, really like a little baby, a little child, like a toddler. She took me by the hand over the parking to the ER department. And I have no memory of that. Really, I mean, in my youth times, I used to drink a little bit too much and I had blackouts and I can't remember what I did. Like, you know, I was accustomed to this kind of blackouts. Let's say it like this. But this was like, I don't know, probably like 30 years ago, you know, when you're in a group of youngsters and you party a little bit too hard. And this was the same experience. It's really like at a certain time, the body switched off the lights and you are cruising on autopilot. I was then, now this is narration that my wife then told me because she created a big timeline on this case, that the nurse, while my wife was at the registration to sign me in, the nurse came, routine check your vitals, you know, blood pressure, your blood rate, and then she also luckily picked one of my fingers to take the blood sugar. As soon as she had the reading, she started screaming. And then there were 5 doctors taking care of me. Sorry, guys. All right. So then I was having VIP treatment and directly put on a room and IV within a minute or 2. I was in full treatment. Because I was about to get into coma. So the fantastic thing about your blood sugar levels and glucose is that it has an immediate effect. So if you're on low blood sugar and you get glucose intravenous injected, it's within maximum 15 minutes, you're on normal levels. And for me, it was actually then like being on this bed that my wife said, within like less than 10 minutes, I woke up, my mind came out of the darkness, and I was actually starting to argue with the doctors about what's going on. Why am I here lying in this room? And the next thing is actually that the doctors then had the prescription and the medication, looked at it, and they started laughing. And they said, we don't need to do any more tests with you. You had the problem about extreme, how do you call it, severe hypoglycemia. So meaning that your blood sugar levels are really like in an extreme low way. And that it just kept me. So yeah, the medical expression severe hypoglycemia is that it's so deep that I couldn't do anything anymore. As I said, I was in the valley of the dark. And severe in terms of medical exor is like a critical situation that requires urgent intervention. Okay, not complex in this case because it was only injecting sugar or glucose. However, a few minutes more, and I might most likely not be standing here in front of you. That chance to start actually my third life, not my second, but my third life. But this is a different story. Got me to think about, hey, I was stupid about trusting the doctors, about trusting the pharmacist. I had the prescription, I had the medication at hand, but I never gave it a second thought. And this gave me then the situation about reviewing a couple of things, and you will be surprised that medication errors are not unusual. Yeah, it's a global health situation in general. However, it is disproportionate impacted in Africa or even in Latin America. Yeah, so in not so developed industrialized areas where easy access to the latest medication or medicine is not available. And this is actually then the situation that it can happen. And in the aftermath that we then talked to people in the family, in the neighborhood, it actually turned out that I was not a single case. There had been, we heard from one of the neighbors that his aunt actually passed away because she needed an injection and it was the wrong. So literally they injected her, 2 hours later she was dead because they received the wrong injection from the pharmacist. And there are other cases. And I actually did a lookup that even here in South Africa, it seems like around a quarter that medication errors are happening. So yeah, I hope that whenever you get your medication, that you double check that it's actually doing what it is supposed to do, and not that it's a mishap that somebody grabbed it from the wrong shelf and yeah, he accidentally gave it to you. However, I have to say, in the context of Mauritius, is that when you go to the pharmacy, it's not that you get the full package. You don't get the actual inlay paper with all the indications, risks, and counterfeits. So what happens is they see prescription, 3 tablets a day for 4 days. This makes 12. Then they take the strips out. They cut exactly 12 pills, put it into a brown bag, and hand it over to you. I don't know what's the situation in South Africa, because I know Discam and Checkers, I think, you have the pharmacy counter. I hope that it's not this way, but maybe somebody can comment on that. Huh? Similar. So I hope that my story is then having some ripples here, that this can be avoided. And so yeah, medication errors are, as I said, not unusual. They are a global problem, and they are quite in a higher proportion ratio in Africa. And the funny thing is actually Mauritius, compared to South Africa, you have a statistic. In Mauritius, there's not even a statistic for that. So it's like, yeah, we heard about it, but we can't tell you how many cases. So you are a single case. You are a single case, and you are a single case. So nobody knows. And that's actually also a problem, because after this experience and having the conversation with other people, is that I started to look into what are the reasons of these kind of medication errors, and why is it that, for example, regions like Africa or Latin America have a higher outcome, or let's say a higher appearance of that. And one of the things that came up is that weak healthcare infrastructure. I mean, I have to say, well, healthcare in Mauritius is free, even for tourists. Yeah? But again, it's the problem that it's not on the latest things. You might also have a situation where you get like medicine that is on the edge of being expired, or maybe because of the tropical heat, it had been impacted by the climate. So you never know. On the other side, like in a lot of industries, the lack of professionals, especially then like pharmacists, being not only about being available. So, I mean, these are humans. They have good days, they have bad days, and grabbing the wrong medication from the shelf can happen. It's just not supposed to happen. And yeah, as I mentioned, substandard medicines, meaning we don't have the latest developments, we don't have access to the latest medication, maybe inadequate training, or it's that they were trained as a nurse, they were trained as a pharmacist, they had the education even as a doctor, and then they just let it fare in regards to what is possible. And so it might also happen that, not like it was in my case, about having the wrong medicament or medicine from the pharmacist, but it might be also the situation that the doctor actually prescribes you a medication that has counterindications, whereas there are substitute products that are newer and are better developed and are actually more friendly, or let's say body friendly for your physique, so that the risk of side effects is lower. Good. Now again, the idea came up about AI. The keywords that everybody is making lists or taking note of today, is that I thought, okay, everybody has their mobile. Yeah? Anyone in the room that doesn't have a smartphone? I don't think so. Some even might have two. And I've seen people here, especially some of the Uber drivers, they even have 3 devices. So I'm really impressed about that. So meaning, if you install another app on your mobile, there's nothing to lose. There's nothing, to be worried about in regards to the functionality of your device. And so the idea came that actually out of this simple constellation about having the prescription and maybe the receipt or the actual medication received from the pharmacist, that using AI or an AI model that can use your camera, that you can take a picture on the spot, or that you maybe even just describe about what's necessary, or what is the, what is the indication, what are your symptoms, and this is the medication that you got prescribed from the doctor, that to see whether there is a little bit of a classification. Is this matching? Does the prescription match the medication that you received? Does the prescription match your described symptoms? Is the medication the right one for you? And in the end, it just gives you a warning, like, how is it called? A robot? Green light, orange light, red light. And yeah, even if you would consider just two colors, green light and red light, in the style of Squid Game, red light, green light, at least you get an indication about whether it's okay. Yeah, we cannot rule out false positives. However, if you get a red indication, a warning, then at least it should ring your bells and set you on alert that you might call the doctor. Hey, listen, I received from the pharmacy a product called Amaryl M500. Is this the one that I was supposed to receive? And the dentist would actually then say, obviously, no, it's not. But it also can happen in regards to other scenarios, because as I mentioned, I was at a dentist. Why would a dentist prescribe a medication for diabetes? Yeah, this is the other human error that the pharmacist did, that, hang on, this prescription comes from a dentist, not from a GP, not from a, specialist for diabetes. So that should have already rang a bell with the pharmacist. However, moving forward, as I am a professional software developer, it's like, how do I do that? Now I have the idea. Everything is cool about ideas. It's about execution, because ideas, it's like everyone has ideas. Yeah, tons of ideas. I have piles of ideas, but no time. And on the other side, as a professional software developer, doing coding the whole day in and out, is the question, how would I implement this kind of software, which I think can save lives? So staying motivated, it's also in regards to not getting into a burnout situation. Coding as a hobby doesn't work really for me. Anybody in the room? After office hours, still coding? 1, 2? No? Hardcore no? Yeah, I agree with you. Well, I have to say, I'm sneaking in maybe, for some open source project. I do a little bit of side coding, but this happens on the weekend when I have nothing to do, when the household chores are done. And I'm like, having nothing to do in the garden. I consider about, hey, wife, I'm doing some important work, popping up the laptop, and then I'm on one of my open source libraries that actually helps to use AI in .NET environment. But yeah, it's a balance act. Do you want to code in your free time when you do coding literally like 6-7 hours every day during the week? And so therefore I came up with the thing about, hey, vibe coding. Yeah, sounds good. Who is not vibe coding nowadays? And meaning, there's so many coding agents, let's get them to the rescue. But then it's like being at the supermarket, you're in front of the shelf with the cereals, and it's like, which flavor should I take? Should I take the nuts and the raisins? Should I take the whole grain? Should I take, the gluten-free one? I don't know which coding assistants, and there are so many. So out of this, I thought, okay, I have to start somewhere, and I gave it a shot with, first the idea about how, or actually why not. And again, it's about, for some fun, also from a, let's say, curiosity aspect about, hey, how good are these agents are working? And, doing some research, narrator says, skimming and scrolling on social media. I came up with the report from some of the people's like, you know what, if you do vibe coding, prompt, review, and reiterate. Shoot and forget. If the result is good, you take it for the next iteration. If the result is bad, throw it away and do it again. So I thought, okay, why not? And if you give those agents some work to do, it's also pretty interesting because they run in the background. So meaning I give them a task, and with a good employee or with a team member, everybody has estimations. accept agents. They don't give you an estimation about how long they might take. So I gave them a task and I left the laptop. I could do some other things, you know, check out what's happening on the outside, have a chit chat with the neighbor. And after a few minutes, I came back and have a look about, hey, agent, what's your outcome? And so in this case, I used actually different agents in order for the different tasks, about the UI, UX experience, about the actual backend services, and about how to integrate a model, an AI model, that understands medical context. And it was an interesting experience. And I really went the range about using, you know, Windsurf IDE with Claude. I went for Copilot. I went for Gemini, CLI, and bits and pieces. So, you know, the whole range of agents that you can take in. And the outcomes or the results are very interesting and different. And I also thought, instead of vibe coding, why not start with a little bit of napkin coding? You know, typical scenario at the dinner table, you scribble down, maybe one of your child's, hey, put this one so in and so in. And the interesting part is also you can give these images to your coding assistant or coding agent, and it can generate code. So overall, it was very interesting to see about what I can achieve with not doing much. So here's an example about what I did or what I received is that step one, in my MedBuddy application, I need to have an input in regards to the prescription. It can be done, as I mentioned, you can type it in, you take a picture, or you already have a picture and you just load it into the application. Next step, medication received. Looks all very cool on mobile. And as well as like you can give in a text, camera, or a picture and see what happens. And then as the last step, you get the analysis result. Yeah, I mean, we see here like the medication name, the amoxicillin, 500 milligram, twice a day. This is already a difference. It doesn't say 3 times a day. Yeah. And what is the instruction? Take with food. Okay, makes sense that you have some sugar that you consume. I mean, in this case, you don't need it, but for the amyloid. But on the other side is then the medication received, and it can give you then an indication, as I mentioned, red light, green light. Yeah, Squid Game. If it's red, you're dead. So this was like using one of the, let's say, UX, UI agents, and it went very, very quickly forward. Actually, it's called Stitch. It's still in, it's from Google. It's still in preview, but it works nicely. However, you need to use Chrome browser or Edge browser in order to use it because I had some issues with Firefox. The other thing is that now, okay, now I have my UX designed. Now it's a situation about which model. And has anyone been on Hugging Face? Yeah, Hugging Face, yeah, over there. So it was me being Hugging Face. If you just type in medically trained model, yeah, the results is not in the hundreds. The results is like in the thousands. And it's like, which one to choose? And it's, again, you're like in the candy store and you know, do I take lollipops? Do I take marshmallows? Do I take gum bears? I don't know. So they all fitting the requirements that I need. And again, I went the safe, for me, the safe path with Google. They actually have a concept. They have a model that is called MedGemma. So medical model for based on Gemma, which is an open source model. And it's not too large. You can load it down on your device, and it can also run on a mobile because it doesn't take too much memory. And so that, okay, this was sorted. And then last but not least, I was then enjoying a healthier life because now, sorry to say that I cannot show you the actual product itself. I would have loved to, but it's not on my mobile yet. With this is that I got the aspects that I also took then medications, prescriptions from my mother-in-law to check on her regular things, if there's anything that it could be a warning sign. I was listening to the conversations that we had with the neighbors as well, and entered a couple of test cases, and it all came out like with a warning, which means that take an AI-assisted system at least for second opinion. Yeah, it's not judgment, but at least it can ring the bells and give you the alarm signals about, hey, something is not adding up. And I have to say that on my side, I will do for my family, from now on, I will check everything that I receive from the doctors as prescription. I will counter check everything that I receive from a pharmacy, just with a quick taking a picture. Tell me if is this helpful for this kind of symptoms, yes or no. And this is not a unique case. It's not a new idea. Because even if you look into other medical studies where it's about breast cancer for women, so mammography records, they also have been sent through an AI scan after the doctors reviewed them, and they had been positive findings that had been overlooked. But of course, there had been also false positives where the AI system detected something wrongly. This can happen, which is, of the other side, it's not bad that this happens, that you have a false positive, because then at least another human, another doctor, reviews the scan again. And here as well, you get the wrong medication, check it. If there's an alarm, call your doctor, speak to the pharmacist. If there's a mistake, yes or no, because it can and it will save your life. And with that, I would like to thank you very much for your participation and patience with me. And last slide will not come up. Yeah, my name is Jochen Kirchstetter. I'm based in Mauritius as a software developer, and I like fiddling around with AI-assisted systems. And yeah, I would be really glad if you join for a couple of questions or conversation then after the talk. Thank you so much.